This video is disseminated by Rocket Doctor AI. Welcome back to Stock Therapy with Penny Queen. Today I have Dr. Issam Hamza with Rocket Doctor AI. Welcome back.
Thanks for having me back.
All right, so I'm really excited today to be able to show everybody a demo of your GLM. Can you tell us a little bit more before we get started?
Yeah, so the GLM, as you know, the Global Library of Medicine, is a proprietary software that we have here at Rocket Doctor AI. And it is, as I mentioned before, basically an AI version of a doctor's brain. It thinks like a doctor's brain. It has the ability to ask questions of a patient and understand many different things and be able to diagnose over 1,000 diseases in real time, has over 17,000 risk factors and symptoms that it can draw from. And I want to show on today's demo some of the power that it has. So we'll show you a few different demos, one patient facing, one physician or practitioner facing, where you can kind of get an idea of how it can be deployed and who the customers can be. And so would love to show you that in real time.
All right, I'm ready.
Great. So let's start with just a patient-facing solution. And for now, I'm just going to say myself as John Doe, 1960. And you can add other things like risk factors and so on, whether I'm a smoker or whether I have a history of heart disease or whatever you want. It can be all in there. The more information the GLM has, the more accurate it is. So I always compare it to a good doctor who will look at your charts before they move into the room with you. They'll actually look and see age, sex, whether you smoke or not, your past medical history, your medications, all that stuff before they come in, because that shapes what the first question will even be and what the further questions will be after that, depending on who you are. And, 20-year-old with chest pain is completely different than a 60-year-old smoker with chest pain. And so those are things that we have to take into account. The GLM does that too. The more information it has, the more accurate it is. So for this case, I'm not going to complicate it too much. So this is going to be patient-facing. Again, the interface will be depending on who the customer is. So certain customers want it to be fully voice right from the beginning, or calling the patient and start talking to the patient. In the background, it's going to be this kind of information where it pulls from the chart about age, sex, and so on. And then we can even have diseases coming from the chart. So for instance, for this patient, let's say they do have diabetes. So let's put in diabetes here. And let's say that they also smoke. So let's put in that they are using tobacco. And we'll start and we'll go ahead and just do that. Now, again, like I said, this is not something the patient would be entering themselves historically in this format or this interface. It is just a demo to show you kind of the brains behind it. It can be presented in many different ways. It can be point and click. It could be speech, just talking. It could be whatever, but it is very important, as I mentioned before, just the way doctors take into account everything in the chart before going into a room. We have this GLM, the Global Library of Medicine, does the same thing because it becomes more accurate when it does. The more information we have, the better the output.
Okay.
So let's go ahead and start.
Hello. Are you John Doe?
Yes, I am.
Great. Could you please tell me your primary symptom today?
I'm having chest pain.
I can assist with that. Let's begin the diagnostic session for your chest pain. Where does the chest pain hurt the most?
Kind of in the middle of the chest.
Which of the following best describes your chest pain? Burning, stabbing, aching, crushing, or tearing?
Crushing.
Is the pain constant or does it come and go?
It's pretty constant now.
When did the chest pain begin? Less than an hour. Could you please tell me when the chest pain began?
Yeah, less than an hour ago.
Could you specify more precisely when the chest pain began?
Yeah, about 30 minutes ago.
Is your chest pain worse with a deep breath?
No, it's not.
How long does the chest pain usually last?
It's been pretty constant for the last 30 minutes.
How is the chest pain changing over time?
I think it's getting worse.
Do you have chest pain now?
Yes, I do.
Does the pain go into your back?
No,
Do you feel more tired or fatigued than usual?
not really.
Do you have a cough?
No.
Thank you for providing all that information. The diagnostic session is now complete. Let me just gather the possible diagnoses for you. Based on the diagnostic session, here are the possible diagnoses. 1. Myocardial infarction, heart attack, 51.81%. 2. Stable angina, 27.25%.
Sorry, can you just explain to me what heart attack really means?
Of course, a heart attack, medically known as myocardial infarction, occurs when blood flow to a part of the heart is blocked for a long enough time that part of the heart muscle is damaged or dies.
Great. Sorry, do you mind repeating that in French?
Une crise cardiaque ou infarctus du myocarde survient lorsque le flux
Sorry,
sanguin
I
vers
forgot I don't understand French. Can you just tell me what I need to do next? Thank you.
Certainly. Here's what you should do next. 1. Seek immediate medical attention. Chest pain can be a serious symptom, and it's important to consult with a healthcare professional as soon as possible.
Okay,
2.
thank you.
Follow. You're welcome. Take care, and please consult a doctor as soon as possible.
Great. So that's an example of chest pain.
That's very impressive, especially the ability to switch languages. That's
Yeah, no, I think again, we can have a lot of fun with this and go through a lot of different examples and so on. But I think it does show the ability to talk openly, and because patients are not educated in medicine, so they're not going to say the perfect word, or they may interrupt and things like that. So you want to make sure that whatever's talking to it has the ability to adjust accordingly and have those wide guardrails to capture a lot of different things. And one of the things that I've noticed from, let's say, competitors or other solutions is that anything kind of AI related with regards to healthcare and agents, voice agents in particular, are very narrow guardrails where they only deal with one thing. So they'll be like, this AI nurse is only going to deal with your chronic kidney disease or your diabetes only, or whatever it is. And if there's anything else, so what I like to kind of explain to people is what we're talking about is something that's available from the beginning of a patient journey where you're not even seen yet. So the triaging part of it is the next frontier in healthcare delivery. And it is the biggest issue right now of inefficiency. The reason there's so much resources being spent a lot of times is the inefficient use of those resources, which means that it's patients going in to the clinic or to hospital when they shouldn't be, or patients using resources that should have been used by other people, or patients that should have been seen earlier are not being seen until it's too complicated and now costs the system a lot more money because their heart disease got worse and they had a heart attack, or they should have went in earlier, whatever it is. So I think that onboarding and triaging requires patience. It requires wide guardrails to be able to listen to everything about the patient and what they're talking about. And this is an opportunity to use that in that circumstance, I see.
No, I really liked the different questions that you hear as you see it recalculating, the likely issue as you go along, even when it asks, do you have a cough? Right? As is this chest pain or have you pulled a muscle? Have you?
Yeah, and again, some people, may not understand why it's asking certain things, but I can kind of tell you, like the reason it asks, does it hurt when you take a deep breath? I mean, it's looking for something else, right? It's looking for, it could be lung related, could it be pneumonia or some pleurisy or something else happening there that is not heart. Again, we can adjust it. I made this for the demo purposes where it won't ask too many questions. But you can make it so that it becomes very, very accurate by asking a lot more questions, where it really digs deep into all the different aspects of that pain and where it goes and where it's been and your other risk factors. So you can make it as long or short as you want, as sensitive as you want. It really depends on the customer and how they're going to apply it to their patients. And the great thing about it is when we say customer, we are, like I said, talking to a number of different customers, but also we're using it internally, right? So these are things that we're integrating with the Rocket Doctor acquisition onto their platform with their 400 doctors already on the platform, with their 600,000 plus patients that have gone through it. We're trying to integrate this so that it's part of their process along the way and improve the efficiency and the margins within our own company, which is great.
And that's exciting. You've been working very quickly at bringing all of the technology together, but I can't wait to see where we are a year from now.
Yeah, and that's the exciting thing about, and again, I'm a doctor, but I get excited about technology, right? And the great thing about this is that the GLM, the Global Library Medicine that we have, is continuously improving. We're continuously to improve it. What's really, really quickly changing is the technology that's out there that wraps around it to bring it to life. And those are things that are commoditized. It's not something necessarily we have to develop ourselves because there's a lot of good companies out there developing it. It's very expensive, but also they're coming out and it's becoming cheaper and cheaper for us to use, to the point where it's just going to be standard part of anything you use within the internet. These voice agents, you're going to be seeing avatars, that we're going to be coming out with other things. But that technology is improving like day to day and getting cheaper day to day. And so it's going to be almost, it'll be amazing, like I said, when you interact with this in the future, where you will not know that that's not a human. It will sound like a human, it'll interact with you like a human, it'll have empathy, it'll have the ability to remember you and talk to you about your kids and whatever else. It will be something that is just part of natural use that we are right now thinking is weird. It'll be just normal. Like when we talk to the bank in the future, and the bank agents will be used to saying, "Oh yeah, that's not a real person, but I love how they interact with me." Those kind of things. The ability to have 24/7 availability in all aspects of your life is going to be coming. You'll be not having these 3-hour waits to talk to an Air Canada or United Airline representative about you're going to have those agents talking to you and working with you. So that's just going to be part of the natural use as people start using these different technologies. And what's exciting, again, like I said, is it's getting better and better every day.
Yeah, what I like about this, I mean, I think anybody who's utilizing AI in their day-to-day life understands just how quickly it's getting better and better. But as you said, as a wrapper around your core technology of the GLM, that is very much, we're used to the problems of generative AI and all the hallucinations and things that happen there. But when we talk about the GLM and how it is, it is, for lack of better terminology, it's pure math, right? These symptoms, these underlying conditions, it's doing a complex math problem, not creating something new. There isn't that area for errors to occur. It's a different.
It's dependable. And to kind of give you an example, as I mentioned, I think previously about the consolidation in the space, and I kind of made some references to that. The biggest next frontier, you can talk to a lot of people in the space that understand where this is moving towards in terms of AI. The next big war is on pure, accurate healthcare data, because everything's already been scraped on the internet for free and multiple times, and you have one LLM scraping the other LLM for information. And the problem is, again, garbage in, garbage out, and it's like a game of telephone. It just gets worse and worse as you go along. But the next big frontier is how to train these engines with good data, especially healthcare data, and to the point where there's a lot of protection around that healthcare data. So the good news is we have 600,000 charts in our system, so we have a lot of good data. We have the GLM, the Global Library of Medicine, that is, again, proprietary and cannot be scraped. And that's another important part of it. But the consolidation in the space I mentioned before. So you had Health Navigator years ago, bought by Amazon, as I mentioned. You've had some other ones recently, including Doximity. I think it's called bought Pathways for $63 million. It's a startup out of Montreal. And they had like guidelines and things like that that doctors go by. So just a place to for a doctor to kind of get information about the current guidelines on how to treat diabetes or whatever else. But that was accurate data that this company's a much bigger company went and bought, for $63 million. So it just shows you, and that's a startup as well. That was just a private startup. It just shows you how important good data in healthcare is. All the different ways I show you these demos are just a way to bring it to life. It really doesn't matter what interface it is, how you want to present it. It really depends on the customer.
I think when it comes to the interfaces, I think investors should understand that you have, they can watch them here, but there's multiple ways that it appears. Is it a consumer, pushing a few buttons about the symptoms they're having ahead of time to get triaged better? Is it, the intake with the doctor going through and it's making, the physician better and more accurate at their job? Or is it, where it's the amount of note-taking and the documentation that is happening that is taking away from what that physician has to do every single day and making the practice more efficient for patients and payers and the doctors themselves.
And that's the great thing is we can present it any way the customer wants, and we can white label it, meaning that we can put it under their brand, behind their firewall, on their servers, so that they don't have to worry about patient data crossing servers or going outside of their network. The privacy and security is really important. We have one partner right now that wants our system to call the patient, and we're doing that for them. So it's calling a patient and start talking to them about their issues before their professionals see the patient. So that saves that professional something like 70-80% of their time, which is incredible if you think about it. There's others that want just a simple chatbot for their product, their patient portal that they have. They just want a chatbot to kind of onboard patients and use it that way. There's another one that just wants to deal with diabetes only, and we can make modules out of the GLM. So instead of 1,000 diseases, if all they care about is diabetes, then we can cover for that part of it. So it really depends. And the great thing about it is it's very, very simple for us to do this. This is not like every customer we have like a year of creating something for them. We can turn this around pretty quickly using our APIs that connects through our APIs to their platform. So it's very easy to customize something for them immediately. And yeah, so it's exciting, like I said, as we start announcing some of these contracts and some of these partnerships.
All I heard there was scalability, and that's.
Yeah. And the great thing about it, again, is that we started from zero revenue, and we're going to start talking revenue coming up in Q2 and every time after that. So, I'm excited for the shareholders to kind of go with us here as we grow as a company into a different phase of the company.
Yeah, it is a momentous change. So I'm very excited. And also to see just how quickly Rocket Doctor ramps, because the platform itself has moved so quickly, and being over 600,000 patient visits
Yeah.
is, it's somewhere between 300 and 400 doctors. Is that right?
Yeah, so Rocket Doctor, the subsidiary of Rocket Doctor AI, run by Dr. Cherniak and Harry Cherniak, his brother, have grown incredibly quickly, as I mentioned earlier, and they are, historically, and what we've already announced in our press releases, we've shown kind of that growth before we bought them, and we're hoping now with the resources we have that we can, add fuel to that fire and try to grow it hopefully even faster and scale even faster. But they've been doing a great job, fantastic job, as you saw with all the different news releases.
Oh, yeah.
So they're, you know, independently even they're growing very quickly. A lot of these things that they're announcing are things that are years in the making that are coming out now, and the inflection point of actual revenue. But it was like years of hard work on their part to get to this point, which is really exciting. So hopefully we'll announce a lot more there.
The inflection point. I think that's, if you dig a little bit deeper into those numbers to say if there's 300 to 400 doctors, that doesn't sound like a lot. But when you realize that that small pool of doctors has done over 600,000 patient care visits, you see just how quickly, you onboard another 100 doctors, you see how quickly it grows and the revenue with that.
The last revenue that was announced by them when we bought them, I believe it was 1.9 million Canadian November as an ARR, as an annualized run rate as of November of last year. If you put that into perspective, that was about 95% Canadian revenue and less than 5% US revenue. The inflection point we're talking about is that now California signed on with the first contract of 450,000 patients. There'll hopefully be others that we're going to be able to announce. New York has been signed on with a partnership with CVS Health and EngageWell. And to give you an example of the size of that market, in New York, there's 6.9 million Medicaid patients. In California, I think it's like 30 million Medicaid patients. So, pretty much more than Canada altogether, and just in California, just for the Medicaid patients. So the opportunity just from those even two states, without other states coming on board, is massive. And if you think about that 5% less percentage growing, even as the top line grows, because Canada's still growing very quickly, as you saw some of the news on Alberta and Ontario and so on. That's exciting. That's exciting for many different reasons, including the fact that the margins in the US are much bigger as well, just because of the nature of how things are charged there. So, $18 US per visit in the US that we get as a company is much better than the smaller amount that we're getting in Canada per visit, right? So yeah, no, it's exciting, and I think they're doing a fantastic job, great operators, and now part of the team, which is fantastic. So yeah, parent company Rocket Doctor AI, and Rocket Doctor is a great brand name underneath it, and they're doing as a platform a fantastic job.
Yeah, I am. When I think about the two big components that you have here, and then I look at the competitors sitting with their billion plus valuations, it makes me really excited to be here on the ground level. So, all right, would you like to go over another demo for us?
And let's use this patient here, 1977. Actually, let's go with an older page. Actually, that's fine, 1977. And do you want to do chest pain again or something different? Let's do chest pain again, just to show the difference of the patient-facing one versus the back end of what the doctor could be doing. This is again, the thought would be the practitioner's visual of it. So whether it's a student, a resident, a nurse, a doctor, or even somebody without any education that maybe is before escalating to a nurse, like a hotline or something, being able to use this as what should I do next? What should I do, to escalate it and so on? What should I be asking to make sure I'm getting the right issues with this? So again, 1977, I think the one I did before, the patient was, I was a little bit older, 1960. But for here, again, we're saying chest pain and it's there. So what should I ask next? What should I do next? So again, here, is the chest pain worse with a deep breath? No. And where does it hurt the most? I'm going to say in the middle of the chest. Okay. And how does it describe your chest pain? Is it burning, stabbing, aching, crushing? These are all different ways you can say it. Again, the voice agent, you can say whatever you want. So the voice agent, I could have said, it feels like an elephant sitting on my chest. It'll understand that being crushing. But you can see that because I was a little bit younger patient, it took a while to get to the heart issues because I'm not a smoker here. I didn't have the risk factors I said before. If I add the risk factors, I think that I had in the other one, so diabetes, and let's say I'm a smoker as well, but you should see these numbers change in real time as we do that. So again, smoker as well. Let's see what happens here. Okay, and then it's going more towards the heart versus just stable angina or stable heart pain. Is it always there? Yes. And again, you see all these other questions. So we can ask a lot more questions if we want. What we're doing here is just highlighting kind of the next version of questions you should be asking, but you can go here too. You can ask about other things on here of what you should, or even blood tests or EKGs, what you should do next. It tells you everything right here, right away. So already is already 29%, and I'm going to say that it's getting worse. I'm not going to answer all these questions, but I want to show you kind of how it changes after this. So now it's saying a heart attack, or MI, is about 33%, stable angina, meaning that it's leading to a heart attack, but you probably have some time. So there's heart pain, angina, but it's pretty stable right now. Unstable, meaning it's heading towards a heart attack a lot faster. You better do something a little bit quicker. So, between those three, it looks pretty bad already. But let's say you are a practitioner or a student that is kind of confused. You're on the wards by yourself. What should you do next? It says right here, you should do an EKG next. So let's do an EKG. So again, let's say the EKG comes back abnormal. What happens? Now it's this. And now what should I do next? Well, you use troponin I, troponin T. I've been on the hospital wards by myself as a first year medical student, using a bunch of books. This is before the internet. And so what should I order next? Because the nurses are all looking at you. They know a lot more than you, but you don't want to look stupid. So what do you do? And so for here, I'm going to do troponin I because that probably will give me the information I need. And now 95% heart attack. So imagine this for over 1,000 diseases and growing. I imagine this for things that are not so obvious as chest pain and heart attack. It becomes really interesting because let's say that it isn't so obvious here, but you want to rule out congestive heart failure, or you want to rule out aortic dissection, and you didn't even think about that as your differential. But just you had that gnawing feeling, and maybe it's only a few percentages, but maybe we should do something else, to check for this, to rule this out. That's the exciting part, is that you can now use this as a tool to figure out things that maybe weren't at the forefront of your diagnosis before. If something's not clicking, it's not really exactly what's coming back, is there something else that I'm missing that could be a little worked down?
It seems to me that this is going to make doctors better at their jobs, and it's going to make patients safer. That's what it looks like from my end. What are we missing?
Yeah, and it's a tool. Like I said, we're not trying to replace doctors at all. These are tools for practitioners, for nurses and doctors and pharmacists and everybody else in healthcare. And doctors do not want to do administrative work, number one. So they don't want to be typing and everything else. The great thing about the voice and all these different transcribing tools and so on is that you don't have to do that anymore. And so imagine the patient-facing tool that we just did before, asking the patient a bunch of questions, onboarding them and triaging so that you really do need to see them. Okay, fine, we'll see them. And when you see them, all that paperwork is there in your chart notes already. You're confirming a few things by checking their heart and doing their blood pressure, or things that you have to do physically. And then, you might want to check a few more things. So you might ask some more questions to find out and rule out other things that could be on there, that differential diagnosis. And again, not typing, just talking and doing that. Again, it's really exciting. And then even after you discharge the patient and you give them prescription for medications or something else, imagine now, instead of, because right now you can't afford having your nurse call every patient that left your office, right? It's impossible. But imagine this 24/7 nurse being able to follow up with patients after they discharge and say, how are you doing with your blood pressure medication? How are you doing with your heart medication? How are you doing with your diabetes medication? Or I just saw you got out of hospital for your knee surgery. How are you doing? Do you have any problems with the knee? Is it becoming red or swollen? Or do you have a fever? All those things are important to avoid complications, because right now what's happening is when you're out the door, you're out the door until you see us next. And maybe you can't see us next because we're full for the next 2-3 weeks. And things get lost between then in terms of complications or side effects to medications or whatever it is. So the full continuum of the full patient journey that I keep talking about, the products that we have for every aspect of the healthcare journey for the patient, is the exciting part, is that's what we can provide as solutions to the doctors. And that's very, very valuable. Like right now, as I mentioned before, doctors are paying between $100 to hundreds of dollars a month for just an AI scribe to translate them talking to the patient in the room into notes. That's it, right? Without anything else, without differential diagnosis, without any other additive benefits of it. That's very valuable for them, so they're not typing. And that's worth that much. So imagine now something before the visit, during the visit, post-visit. How much is that worth?
A lot.
I think so too.
And how much is being able to serve more patients worth? I mean, I think that the less work means more efficiency. Like that means shorter wait times for patients, and that's important.
Yeah, if I'm only seeing patients I should be seeing in the office and I'm not doing any paperwork or less paperwork than I was before, instead of a standard practice being 2,000 patients, maybe we can go up to 10,000 patients eventually, where you have that 24/7 nurse at your disposal, you doing all the different things, watching your blood work, lab reports that are coming in, flagging things that are maybe abnormal, contacting patients, and so on. That's the exciting thing. If you ask me where we're going to be in the next 10 years as a country, a world in healthcare, that's where it's moving towards, is that you will have instant and constant access to healthcare.
It's very exciting tech. Nice to see it rolling out like this and really starting to get integrated. So
yeah, no, I'm excited as well.
All right, is there anything else you want to cover before I let you go today?
No, I again appreciate your audience, watching this. And again, we do this because we have a passion for it. And again, for the team, we have a fantastic team. And with the new acquisition with Rocket Doctor, again, Dr. Cherniak and Harry and so on are fantastic additions. And we'll continue to update the market coming up here, and we'll just continue to announce our progress, and hopefully you guys grow with us as well.
All right. Well, I look forward to it.
Great.
All right. Thank you.